Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with our returning wonderful guests here. We have Dr. Paula Ruffin out of New Hudson, and Dr. Gary Ginsburg visiting us all the way from California.
Thank you.
Great to have you both here.
Thank you so much.
So last time I had you on the show, we talked a lot about things that happen in the winter season. Cold and flu season, how we can improve our immune system through chiropractic care. And we talked about slips and falls on the ice and sliding in with our automobile into another car and having whiplash type injuries. The one last thing I wanted to mention and get your guys' input on is repetitive microtrauma for things in the winter, or in the summer for that matter, like snow shoveling or raking leaves, and how that can have a bearing on our spine.
Well, the thing with those types of activities is that they're very one-sided, so they're off-center. So people are typically shoveling or raking to one side. And I don't know about you, but if I go out and I do that kind of activity, I want to get it done. So rarely do people stop and rest or stretch or even drink water if it's in the fall or they're, it's the warmer day and they're attempting to rake leaves, or even in the summer, in the wintertime, we get dehydrated when we're trying to shovel. So a lot of that repetitive motion, they end up overstretching one side of the muscles along the spine, and they end up tightening up another side. So you create this incredible imbalance.
Just to follow up on what the doctor was saying, that most people who are doing imbalanced activities, many times they see them as normal tasks. They don't understand or realize that they should warm up or stretch, or that maybe the muscle strain and sprains that they get from these activities are not just related to the activities, but to the prior conditions that they currently have. So they see them as a muscular injury or a muscular irritation, but it's sometimes more than that. But once again, like you say, when they do repetitive motion, there's added injury that's on a repetitive basis can really cause major problems over time. And people see them as small incidences, but they really aren't as small as they may think.
And we call these type of traumas micro traumas because, again, they are, like you said, small things built up over time. If right now somebody taps on my forehead 3 times, it's going to have no effect on me. But if you tapped on my forehead 10,000 times in a row, I'm going to have a screaming headache after a while. And
or
it's the same thing
with
yeah, I'm going to be ready to punch him after that long. Yeah. So those type of micro traumas can build up over a long period of time. Things like, the snow shoveling in the same position over and over and over, or even things like sleeping in the wrong position for 6 to 10 hours a night, every night for years with their head tilted the wrong way, or too many pillows. These are types of micro traumas. Along with a lot of the things that people do now on a regular basis, they're on their computers. They're on their cell phones texting. They're talking on their cell phone with their shoulder down like this. And they're doing this for hours and hours and hours at a time. They're driving cars bent over like this. These are small micro traumas that amount of force, that amount of tension that's put on the muscles and ligaments can help to wrench and pull some of the vertebrae out of position, which can then impede or impair on the nervous system and the immune system. Even things like, women wear their purse all the time. And, I don't know what my wife puts in that thing, but it's heavy. I see people wearing 20 pounds, 30 pounds on their shoulder all the time, tilted like this. Children wearing backpacks. I see kids wearing 50% of their weight on a growing and developing spine with their head in flexion. And when their head is in flexion like this, where it should be arched or curved backward, when their head is in flexion like this, they're placing 2 to 4 times the weight of their head right here, a little bit lower down at the bottom of their neck and their upper back. We wonder why so many people have so much tension in the upper back and the bottom of their neck. And these are things that people do as adults, but look at some of the things that children do on a regular basis that are micro trauma. What are some of the things that your children do, Doc, on a regular basis?
I think backpacks are really a huge detriment to these kids' health. And many times, people in general, whether they're an adult or they'll even pass it off on their kids and say it's just a muscle pull, or their muscles are tight because of the backpack, when they're not really recognizing that these muscles are attached to the spine and that it literally is pulling things out of alignment and affecting how their bodies work. And commonly with kids, especially with the backpacks or sports, they're constantly out of alignment, and so we've got to check these kids. If we can balance out a child's nervous system, then we start seeing changes such as improvements in things like attitude, mood, better in school, gut issues. Gut issues are so big in kids, and I don't know about you, what you see, but I see a lot of parents bring their kids to me not so much for back pain or neck pain, but they're experiencing other health issues that they're not able to find help somewhere else.
Allergies, asthma,
exactly.
ADD. We see dozens of children with these conditions, and we have amazing results. I have so many testimonials from parents that we've helped their children with things like that. Infantile colic, cerebral palsy, asthma, all sorts of amazing things that we've seen with some of these children.
Also with young kids, hyperactivity is something that's not looked at in the right way. Sometimes they want to treat them with medications, but there's also a broader, more natural approach to chiropractic that can do a lot in helping the child to regulate his body's systems, and like you said, improve in their learning skills and their attention improvements. So much of what is to be said about how kids start as youngsters and adolescents and growing up can be accentuated as an adult. If you don't correct them when they're young, there's a far greater price to pay than one really imagines. So it's important to see kids when they're young, and I get my best pleasure in helping a young child to develop properly over his lifetime than to help treat adults with emergency, quote, pain care. And it's really a pleasure to help youngsters develop in their natural health as well as their physical health through chiropractic care, and that's really a wonderful
Absolutely,
thing.
and they say, an ounce of prevention is worth a pound of cure, and that is exactly the case. Like you said, that ADHD, which is a really big buzzword now, and that so many thousands of children in our country have, and they're treating with medications and other things, a lot of times by dealing with these nerves at the very top of the spines, these nerves that control things like attention and brain function, we can have some really amazing and profound results with that being drug-free. And one of the things that parents may say all the time when we say, we'd like to take a look at and see how your children's spine look, they say, well, my kid doesn't have back pain. Why should they get checked? I'll ask them things like, well, do you have them brush their teeth? They don't have tooth pain, but do they brush their teeth and do they go see a dentist? Well, absolutely, because people realize it's important to prevent tooth decay, to prevent cavities, to prevent degeneration in their teeth. Well, it's equally, if not more important, to do the same thing in their spine. And so in my office, most of the people that come in are families. We take care of mom, dad, all the kids. We want to maintain and keep their spine as healthy and as well as possible. So we see a lot of people for what we call wellness, maintenance, or preventative care.
I see a lot of scoliosis cases in my practice, and if I have the adult that comes in and I see scoliosis in their spine, and then I find that they have children, I'll always recommend to them to bring their kids in and have them checked. Once an adult, their skeleton is formed, we can help their spine. If they have a curvature in their spine, we're going to be able to help them to be as balanced as they can within that curved state. So for example, if an adult comes in and they have a curvature such as this in their mid-back, well, I'll show them on the x-ray, and their lungs are here, their heart is here, their stomach, all their digestive organs are here, and now all of a sudden they can start to see that these nerves are literally affecting how their body is functioning. So when we translate to the children, and I'll say to them, do your kids have problems, like does your child have colic or reflux, or do they have ADD, ADHD, are they chronically sick? We start asking these questions. And you have scoliosis. Scoliosis is familial. It can run down the line. However, once these kids come in, and I will take an x-ray if I see spinal imbalances that lead me to think that there's a scoliosis, and start adjusting them. And within 4 to 6 months, I will re-x-ray. And this scoliosis in a child who is still growing, if we still see growth plates, I've even seen it up to about 18, 19 years old, where we've completely reversed scoliosis in young people who are still growing. And it comes down to, I think you mentioned earlier, Doc, that we remove the interference to how the body's functioning, and it will then grow the way it needs to. And in kids, I have seen it 100% of the time completely resolve in a scoliosis. And how many parents have stood in front of those x-rays with tears streaming down their face because nothing else was going to be done to help their child.
And one of the reasons why it's so much easier to correct this type of damage in children is because their bones are softer. Their bones are much more cartilaginous and more pliable than adults. A child's bones are 40% cartilage matrix, where adults are about 25. So their bones before puberty are much easier for us to mold while they're still growing, while they're still developing, rather than once they're an adult and it's already set in. And of course we can see great results with that adult, but not nearly as much as we could have when they were a child. So I always tell people, I hate to see people come in to get well, but leave their kids home to get sick. I don't want to see their kids come in at the same age there with the exact same spine that they have now.
That's a great point that you bring, and thank you for explaining that, because most people don't understand the actual importance and awareness of how we can help young children who have a problem. They see it maybe as an adult problem, but not a developmental problem, and where we can catch it early, we can do a lot for that child for the rest of his life. Also, speaking of young kids, a lot of parents would say that, well, they had some pains that went away, and those are just, quote, growing pains. And there really is no such thing as growing pains per se. There's usually an indication that something is wrong. The child can't always communicate it to you. And once the pain goes away, it could leave a developmental problem with the spinal alignment that's misaligned. So that's another reason with young kids to treat them early and often so that they understand and learn and benefit from the approaches of chiropractic care at a young age.
So how young are the youngest type of children you take care of?
My youngest patient was 2 days old.
2 days old.
Yeah.
And so let's talk to our audience about why would a chiropractor take a look at or check or make an adjustment on a 2-day-old baby?
Well, anyone who's had a child or who's witnessed a birth can attest to the fact that, you know, when the baby comes out of the birth canal, just in a normal vaginal birth, coming through that birth canal is very, very stressful, and it's a tight squeeze, I can tell you from personal experience. And as that baby comes through, what has to happen in order to get the shoulder is that the doctor literally has to twist and turn their head and apply pressure and pull and possibly depress the shoulders. A lot of children are born with clavicle fractures or some kind of a palsy or a torticollis because of all of this stretching. There's a giant bundle of nerves that comes from the neck and goes down into the shoulder called the brachial plexus, as you know, and that plexus of nerves literally gets stretched and can get torn in a case of a torticollis or even in a clavicular fracture. And so all of this stress and then getting that baby out can create this misalignment on that upper cervical, where that is the part of the spine that holds the most receptors. And receptors are little detectors in the body that communicate with each other, that tell the brain what's going on. Well, for example, you know, there's hundreds of thousands of receptors in the upper cervical spine, and there's, you know, thousands down in the lumbar spine. So we want to make sure that this upper cervical is balanced to make sure that those signals are coming through. The other thing that people need to recognize is that in a C-section, there's actually much more pressure on the spine of that baby, and so there's more forces to get that baby out of the abdomen in a C-section than there actually is in a normal vaginal birth.
Less.
They think it's less. And then, of course, add forceps or vacuum extraction.
Yeah, and let's take, for example, let's say the woman's pelvis is maybe smaller or it's misaligned to some degree. Now the baby's not coming out as easily, and so what do we have to use? The
forceps or
vacuum extraction, which can put even more force, even more trauma on that baby's head and neck. And so I'll ask people this all the time. Let's say this baby now comes out and they're only functioning at 90%. Would the baby know it?
No.
No. Would the parents know it? No. And that's why in our office we take care of so many children, infants, babies, teenagers, just to keep that nervous system and that immune system growing and developing at 100% and thriving as well as we can. That's why it's important, just like we were saying with, you know, kids brushing their teeth as soon as they have teeth, it's important to take care of their spine as soon as they have a spine, which is right off the bat. And we see also a lot of times, you know, as the baby's developing in the womb, let's say there's twins or there's triplets, and I just recently took care of a mother who just had triplets. You know, those babies are crammed into that little area, and their spines are more likely to grow and develop in the wrong angles, in the wrong places while they're just first forming. So it's important to make sure to take care of the spines, you know, right from the get-go. Make sure not only when the baby comes out their spine is healthy, but what about while the woman is pregnant?
Well, the very first thing to ever form is the brain and the nervous system. When you get those two cells to come together, we get nervous system development right from day one that controls and orchestrates everything. So the woman's nervous system is controlling and orchestrating how this baby develops, which is, if we keep her balanced and aligned, then that will allow her body to be able to help the baby develop the way it
Well, that's
needs to.
interesting, because when I treated pregnant women, many of them were complained of low back pain as well as sacroiliac discomfort. But when you treat them, it enhances and helps the delivery process immensely. And it also helps for the baby to develop better, and also for a more normal birth, childbirthing. But also, when you treat a pregnant woman, you're really treating two people at the same time, aren't
Right,
you?
absolutely.
And also, just to make a little side note, when you're adjusting a young child, it is very delicate amount of pressure that's used. It is not the
Great
same
point.
as treating an adolescent or an adult by any means. It's fingertip pressure. So it's a very gentle approach, and the babies love it. They understand it innately. Their body
Most of the time
accepts
they
it.
giggle, they
Yeah.
laugh, they, you know,
Yes,
they
and
like
it's a
it.
very non-stressful event for the child.
It's not
a
what they see,
wonderful-
you know, in a karate movie, or, you know, where
Yeah.
they sneak up behind
Yeah.
them and do a neck breaker,
Yeah.
or a Vulcan neck pinch or anything like that.
Right.
It's very gentle, very easy. And a lot of times the principal's like, that's it, that's all you did? And that's all it takes to move those tiny little cartilaginous bones in an infant or in a child.
Well, and a lot of times people, that's a hesitation, because it's such a great point, is the amount of pressure that we would put on a child's spine to adjust them, where I would adjust you very different than I would adjust you. And that's what I tell people. Well, your husband is 6'4" and you're 5'3". How do you think I know how much pressure to apply on each one of your spines? You both require different pressure. So we are trained, and that is part of our training, that people need to understand, that we know exactly how to palpate and feel how those spinal bones are misaligned, and be able to know and understand how much pressure to apply to each and every spine we have in our hands. Not just an adult, a male, a female, but every single person is different.
That's true. There's never a cookie cutter method of treating any patient. You have to do a diagnosis, an examination, and a history to understand what it is you're doing with that specific patient on that specific day. So it's always a very specific approach in chiropractic. It's not one in which everyone is treated the same. Everyone is treated as an individual according to their needs and their situation of their spine.
So we have a short video clip that we'd like to share. It was a local news station did a story on chiropractic and pregnancy, and we'd like to show our studio audience what it looks like for a pregnant woman to get a chiropractic adjustment.
Great.
So let's take a break and roll that clip.
Well, pregnancy can cause all kinds of changes in a woman's body, and back pain is one of them. But you don't have to live with the discomfort. Here to tell us about better backs for moms is Dr. Caroline Bonflugi from Balance Atlanta Family Chiropractic, along with expectant mother Britton McLeod. Thank you both so much for being here.
Thank you.
Doctor, let me begin with you first. Why is it that women experience so much back pain? Is it because of the weight gain?
Partly. My specialty as a doctor of chiropractic is in the spine and the nerve system. And as a mom develops, or as the baby develops, obviously she's gaining more weight. So the body has to compensate so that she can stay balanced. The other huge factor is that by the time a mom's, let's say, childbearing age, she sustained spinal injuries throughout her life, whether she was a gymnast or whether she was in a car accident, slipped and fell, carried a heavy backpack, sits at a computer. So it's the stress of that on the spine, as well as the mom's body's producing a hormone called relaxin, which causes the pelvis to get a little more soft and loose in preparation for childbirth. So as the spine's a little more flexible, those spinal bones can get out of alignment, which put pressure on the nerves, which can cause lower back pain, upper back pain.
Yeah, and a lot of traditional doctors, a lot of women just think that they have to deal with it. It's just part of being pregnant. But you say that there are some techniques that you can offer to alleviate some of the discomfort.
Sure.
And it also helps with the baby's health, too.
Exactly. My approach is this, especially in this country, there's so much fear associated with being pregnant, with the delivery, and to usher a new life into the world is a miraculous experience. So why not make that as healthy and comfortable for the mom while she's pregnant, to make sure labor and delivery are as easy as possible, and also to put as little stress on that delicate baby's spine and nerve system during the birth process.
Okay, well, let's get Britton into place.
Sure.
So we can see you perform some of your techniques on her.
Well,
And
this
explain
is
what
a
you're doing.
portable chiropractic table, and in my office I've got much bigger tables with all sorts of bells and whistles, and I'm not actually going to be doing adjustment,
Okay.
but what I look for actually on a mom is I look at the alignment of her spine. And actually, Britton, if you don't mind, do you mind standing up for just a second? Obviously, with a pregnant mom, I'm not going to do x-rays like I would with another patient. And I check posture. I look for spinal distortions. And what I mean by that is oftentimes the head's more anterior than the shoulder, which puts stress on the upper back and the neck. Also, with pregnancy, there's an increased curve in the lower back, which again, because of the weight up front, there's more stress here.
compensate,
Exactly. Then I look at the scapula, the chicken wing bone, so to speak. Is one higher than the other? Is one rotated out further than the other? I look at the spine to see, is the rib cage symmetrical? If it's not, if one side protrudes more than the other, it could be an indication of scoliosis where there's a curvature of the spine, which is not something you want to have. I also look at, if you just turn around, face the camera, I look at the symmetry of the head. Are the ears on the same level, or is the head tilted a little bit? The muscles of the neck, is one side protruding more so than the other?
Now, how many months along are you, Britton?
7.
7 months. And have you had treatments and adjustments with the chiropractor?
Yes.
Okay. And
With all 3 of my
how's that
pregnancies.
with all 3 of your pregnancies? So it's been effective for you.
Yes, very.
Wow, interesting. All right. So can you show us something that you can do?
So this special pillow is something that I have in my office, and it's foam core, and it's got a little area that's hollowed out which can accommodate the belly so the mom can actually lie on
Okay,
her stomach,
yeah.
which is very comfortable. And what I do, it doesn't look that exciting on air, but when I'm palpating, I'm examining the spine, I'm looking at the symmetry of the spinal bones. I'm also checking for any kind of muscle spasm, any kind of swelling. And someone who reads Braille, they can distinguish between the little points
Yeah.
on a sheet of paper. I can't, but in 15 years of working with patients, my fingers, as my patients say, have little GPS finders on
become
them.
very sensitized.
Exactly. I can find out exactly where the problem is. And you can feel that by the muscle spasm, by the range
So
of motion.
how many treatments typically would a patient need to come for during the course of pregnancy?
It really depends on her body. The more stress there is on her spine, the more frequently someone might want to come in. But again, my approach is not only if someone has back pain to help correct and alleviate the problem, but also to ensure that the spine is as healthy and flexible as possible throughout the delivery.
Okay.
So some come in for a few visits, some can come continuously.
Okay, excellent. Well, this has been very interesting. Britton, thank you for joining us this morning. Doctor, it was a pleasure
Thank
meeting
you very much.
If you're expecting or if you just want to feel better, check out
It's like for a pregnant woman to get a chiropractic adjustment. I've seen a lot of people in the community that said, well, you know, maybe I'd like to come in and get adjusted after I have the baby. You know, I'm pregnant right now, maybe it's not the right time. And you can see how gentle, how easy it is for a pregnant woman to get a chiropractic adjustment, and see how great it is not only for their spine, but for their nervous system, for the development of the child. And so it's very important. And in our office in Commerce, we take care of dozens of pregnant women on a weekly basis and help them have a smoother and easier pregnancy, not only to keep their spine in normal alignment, but you know, as the baby starts to develop, it actually pulls on the muscles in the lower back. And so a lot of women during their pregnancy will get things like sciatica or lower back pain, obviously, because we have so much pressure, extra force, pulling constantly, causing that micro trauma, forcing increased curve in the lumbar spine, causing some pinching or some nerve irritation, or the baby can be causing pressure directly down where it's affecting the lumbar nerve roots, and that's why you affect the lumbar nerve roots where they come in together to form the sciatic nerve down the leg. So a lot of times women will get that numbness or tingling or lightning bolt type sensation down their leg, and that's something we have really great results with. And then like we said also, by keeping the hips and the pelvis and the lumbar spine in normal alignment, makes for a lot of times a smoother and easier labor or delivery process.
One of the things that women need to also recognize is that they have a hormone going through their system from the time they get pregnant that is called, it's called relaxin, and it literally helps to relax the pelvic bowl so that they can give birth. But what happens with relaxin is it's not specific to the pelvic bowl. It goes throughout the whole body. And so everything in their body tends to get a little loosey-goosey during the pregnancy, which is why it is important, as you say, that they come in, they get adjusted regularly. They're not going to stay in alignment as well as somebody who is not pregnant because of this hormone that necessarily needs to be there. I also explain to my pregnant women that once they've given birth, it's even more important that they continue because the relaxant's still in their system, and giving birth creates such stress on the pelvic bowl that as the relaxant leaves, we need to continue to adjust them and put them in proper alignment, as you mentioned earlier, keep them properly aligned while that hormone's leaving so that when it's gone, now we've got them in good balanced state.
And that's one reason that in pregnant women, they have a lot of times ankle pain or ankle swell because that relaxant affects some of the soft tissue and the ligaments in their ankles. And so that's why it's sometimes they have pain in their ankles or their feet because of that.
Well, the hormone effect is also a benefit because it helps to adjust them. It's a very gentle adjustment, and they're not as tight as they normally would be because, like you said, that loosens the ligaments and there's a little more elasticity to them. So that helps as well. So it's always
Now,
a
what
good
would
thing.
you say if somebody had, a woman had a lot of misalignments, perhaps scoliosis or some degenerative changes in their spine before they were pregnant? Now, would that make a harder or more difficult pregnancy?
Boy, every body is so different, as we talked about earlier, and I've had people who have had very good alignment or a lack of a scoliosis and have been harder to adjust and have harder pregnancies, and people who've had scoliosis. So it's really hard to say. I think the bottom line is that as long as women are getting adjusted and staying in balance, that's really the bottom line for each and every one of
You
them.
want to be as proactive as possible.
Exactly.
And so with pregnant women, obviously because they're pregnant, we don't take x-ray. And x-ray is one of the big diagnostic techniques that we use as chiropractors to determine where there's misalignment, how long it's been there, exactly what degree it is, how to fix it. And so that's one of our main diagnostic tools. But we mentioned a little bit earlier how we use something called palpation. And if you could explain what palpation is to our audience.
Well, palpation is a form of determining the body's alignment of the spines and the musculature as well. It's primarily done with our hands in a very gentle approach, but there's also palpation that is done in combination with movement of the body. So you can actually turn the body in different planes to determine the fixation of the vertebrae and how the spine may not be as flexible in some areas, which would give an added clue as to the diagnosis of the subluxated segments and how to best correct them.
And that's also something done that, without instruments, we use our hands to use, like you said, the static palpation to feel the misalignments and the motion palpation, check range of motion, check restriction, so that we know where we need to break up adhesion, break up restriction, things like that.
Another thing with palpation that's important to note, and people will commonly say, what are you feeling for? And so I will tell them, I'm feeling for where the muscles are restricted. Your spine is made up of 24 movable segments, and it should have fluid motion one upon the next. And so when I'm motioning out their spine and I'm feeling a restriction, I know that segmentally those spinal bones are not working properly. I can also feel muscle spasm, and I may end up feeling swelling in the area as well. So there's a lot of things that we feel for that put that into our diagnosis to be able to say that this is the primary area that we need to be focusing on.
Another thing aside from the palpation, that while we're looking at their spine or physically feeling their spine, a lot of times chiropractors will check people's leg length. And by checking the leg length, and if we see an imbalance, that helps us to determine where there may be misalignment or what we call subluxation, and the degree in which maybe their pelvis has rotated one way or the other way, which may pull up on the leg. Let's say here's a pelvic bone here or an ilium. If this rotates backwards, see how it could pull up on the leg. And it helps to determine the degree and how much misalignment there is there in order to correct it. So thank you guys so much for joining us today.
Thank you so much. Appreciate you having us.
We were here with Dr. Paula Ruffin out of New Hudson and Dr. Gary Ginsburg from California, all the
Thanks
way
for
here to
having me.
join us. And I'm Dr. Adam Rodnick out of Commerce Township, Michigan. Thank you for joining us on Ask the Chiropractor. Remember that God gave you the gift of life, and what you do with that life is your gift back to God. We will see you next time on Ask the Chiropractor.